Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Xanthine. This xanthine, the causes of xanthine is xanthinuria. If the xanthine is seen in the urine, obviously it can result in stone formation, that is xanthine stones are formed by xanthinuria. These xanthine stones are radiolucent. Radiolucent means they are not visible and on x-rays. Because they are radiolucent, they are not visible on x-rays. The stones are smooth brick red and round in color. They are smooth brick red and round in color. These stones are smooth brick red and round in color, and they are also radiolucent. Okay, and they show lamination on cross section. On cross section they will show lamination. This is xanthine stones. Now if you see the treatment of xanthine stones can be managed by taking high fluid intake. High fluid intake is the most effective therapy of xanthine stones. Why? Because xanthine stones, they are caused by xanthinuria. Whenever xanthine is there in the urine, because of supersaturation of the xanthine stones are formed. So if you give high fluid intake to the patient, actually supersaturation will not occur easily, and thus xanthine stones are not formed. You can also give allopurinol, also can be given in xanthine stones.
thank you and thank you for watching.